Academica Media. From Academica Media Studios in Miami, Florida, it's Big Ideas in Education, a weekly recap of inspiration and innovation in your schools.
Welcome to the show, everybody. I'm Ryan Kairalla. We got a great show this week. I'm so excited to have you all here for this week's installment of Big Ideas in Education. We have career and technical education on the brain this week, and we're happy to be joined by Dusty Moore, the CEO of CTE learning solutions provider iCEV, and award-winning STEM and CTE educator Dr. Jeff Crapper. Both of our guests have been leaders in getting the very important conversation of the role that CTE can play in addressing shortages in the healthcare workforce pipeline. You can find out more about our guests' work by visiting icevonline.com. Dusty, Jeff, thank you so much for joining us this week.
Thank you.
Thanks for having us.
Oh, I'm thrilled for this one. As the son of a doctor and as a big fan of getting more people into the healthcare field, this conversation really does have a lot of importance to me. Let me start with you, Dusty. What got you interested in career and technical education specifically as it involves healthcare?
Yeah, so my background in CTE, I was the son of a CTE teacher, and I was a product of CTE programs. So I participated in agriculture science programs growing up through high school. Was a member of the Career and Technical Student Organization and FFA, got involved in that and did that throughout high school and even my freshman year of college. And then really just grew to have a passion for the subject area. At that point, what I pretty much knew was ag science, but, whenever I was a part of that CTSO, we got to work with, students in HOSA and FCCLA and DECA and all of the other CTSOs. And so it really kind of opened my eyes up towards all of career and technical education and just seeing that the impact that it made on students and communities. I knew that I had a future in that. So.
Well, we're glad that you chose that as a future because, man, this is an important field. Now, I'm curious as to what things look like on the ground. Maybe, Jeff, you can weigh in on this one. Given how important this field is and how important it is that we are training effective professionals in the healthcare industry and hopefully have them be job ready by the time their graduation or close to it, I'm curious as to what these programs look like in our schools. Can you give us an idea of what a typical healthcare CTE classroom might look like if I walked into one, Jeff?
Yeah, so your entry-level classes are really going to focus on different career opportunities because, as you know, there's many on-ramps and off-ramps in healthcare. And so that's going to be a big part of that, right, is just giving kids the options and what's available to them. You're typically going to see then some sort of anatomy and physiology class. And then really by the time they become a junior or senior, they can specialize. And so you have high school students that can graduate as EMRs, emergency medical responders, or EMTs, emergency medical technicians, pharmacy technicians, medical assistants. There's a variety of different healthcare certifications they can actually earn while they're in high school and then go straight into the workforce, which is great opportunities for them. And the cool part is that some of those things like medical assisting and farm tech can actually count an EMT count towards their hours for med school if they wanted to go to med school like your dad. And so that way they can actually get that experience while they're doing their undergrad and then hopefully have a better chance to med school later on in life.
That's really fantastic, Jeff. And I would imagine that if we're training people in their junior and senior year to specifically be, say, EMTs, there's got to be some hands-on learning involved there. They're probably doing some things that don't just look like sitting at a desk and reading a textbook, right?
Yeah, definitely. I mean, the cool part about digital learning is that you can actually, there's some great platforms out there that you can do virtual dissections and simulations. Wow. And so as Dusty mentioned, HOSA, I'm a national lieutenant for them as well and help put on their national conference. There's some great opportunities that we see that kids can do digital stuff that you can actually, I never saw until I was in college. But then also too is that they have all sorts of mannequins and other opportunities. So, we can train phlebotomy technicians so they get the arms and they can practice because they're not allowed to use the real arms in high school.
Well, that's probably good.
It's probably good, right? And so, but the cool part is that we have some of our freshman programs actually have kids working and using the phlebotomy arms. And so I think that's the cool part about the simulations and also some of these models that we have out there, is that they can get that experience before and see if it's something they enjoy before they even graduate from high school.
So those education programs sound like the solution. Dusty, I'd like to talk more about the problem. What is the current state of the healthcare workforce pipeline today? Are there any particular healthcare jobs where we're really seeing significant shortages such that we really need these healthcare CTE programs in the schools?
Yeah, absolutely. There is. We recently did a study, which is kind of how we found ourselves on the podcast here. But the World Health Organization is estimating a projected shortfall of 10 million healthcare workers by 2030. And then if you look at just the United States alone, we'll need about 1.8 million healthcare workers by 2032. So there is a large gap. And in fact, Governor Abbott in the state of Texas recently put together a healthcare shortage task force to look at different solutions when it came to how do we bolster our pipeline of healthcare workers. And so that's one example, but I know every state is looking at that and kind of, viewing how we can go through and make sure that we don't have that shortage. Some of your most common, jobs in that area, nurses and all the different types of nurses, from nurse practitioners, LVNs, RVNs, et cetera, all the way down to epidemiologists, phlebotomists, like all the different healthcare fields, there is a shortage. And so how do we bolster that?
Wow. Now, Jeff, given the scope of the problem that Dusty has discussed here, I imagine you must get a very special sense of satisfaction knowing that you are being part of the solution, helping put these programs together on the ground, helping cultivate the next generation of healthcare workers to help bridge this gap. Talk to us about how you got into this area, and was it always just healthcare CTE that you were doing in education? Did you start in another type of CTE program and then moved into healthcare?
Yeah, traditionally, I actually came with the teacher educator route. So I started in health and PE, added English as a second language, and science as well. And then basically one of my principals said, hey, I have a great opportunity for you to teach a sports medicine class. I'm licensed in sports medicine. I'm also an advanced EMT and firefighter. And so having that experience and basically got me into CTE. And so I have my CTE license in firefighting, healthcare, and then also engineering. And the cool part is that they're all kind of interconnected in some ways as well, which is great because that device that you put in your knee, right, was designed by a mechanical engineer, and we see robotic surgery. And so I think one of the cool things about CTE is that we don't have to look at silos. We can see how things are interconnected. And so that's one of the reasons why I love it. The other thing I like too is that, going back to you said, is that it gives kids a context of the learning, right? And that's where the satisfaction actually is that when I have a 16-year-old, helping me respond to a code in my community, because I started our firefighting and EMR, EMT program. I mean, I have 16-year-olds doing CPR, and we actually have been able to resuscitate people. And that's been a huge opportunity for them, but it's also a service to our community, fulfilling a huge need.
Wow. I mean, I can only imagine the kind of satisfaction that must bring you, knowing the direct positive impact you're having on your community and on the healthcare economy, and just getting to see it in real time like that. So often in education, we often as educators feel like our impact is so attenuated from what we're doing in the classroom every day that when you actually get to see such a direct line between the work that you're doing and the positive impact you're having, it must feel incredible for you. Really inspiring stories. Thank you, Jeff. Dusty, tell us about some of the curricular offerings that iCEV has to help move this healthcare CTE project forward as an economy.
Sure. Well, and one thing whenever you look at CTE is that, whenever you look at CTE teachers, they wear so many hats throughout the day. And when you look at a CTE teacher schedule, they might, as Jeff mentioned, you might start off the day teaching anatomy and physiology, then move from there to medical terminology, then from there to health science theory, and on and on and on. So it's not just mastering one subject area, you're mastering several different subject areas. And so what we look at whenever we put together our content is how do we make almost a Netflix for a CTE program, to where as a teacher, you can kind of get into a flow of using the resources, and you're not having to stop and switch over to the next resource if you're going from A&P to medical terms. So we kind of package it all together to make it really scaffold nicely and transition nicely for those CTE teachers that are teaching multiple different preps. So our health science package, we do everything from medical terminology, anatomy and physiology, health science theory, the practicums or the capstone classes in health science. So we have lots of different of the CTE or health science subject areas, and again, package them together to make it easy for you to utilize in multiple different classes.
That's really tremendous. And it sounds like if what you're saying is that you're offering sort of the Netflix of curriculum options for teachers, it sounds, Dusty, like you're trying to create something that is teacher-centered, right? You're not trying to create something cookie cutter that the teachers have to follow step by step, but rather you're empowering them to find the right scope and sequence of curricular offerings that fit the needs of their particular students.
Correct. And, you go to these CTE classrooms and they're doing such innovative, amazing projects, and they're pulling from lots of different resources. We want to just give them a foundation that they can lean on. And especially when you look at CTE teachers, and a lot of them are coming from industry into the classroom. So, they've got the skills, they've got the industry knowledge, but maybe they don't have that pedagogical background for classroom teaching, classroom management, those pieces. So we feel like it's really important to provide that structure and give them some foundational pieces, but then let their imagination run wild with the projects and the activities that they do with their students. Students sign up for CTE classes for the hands-on project-based components of it. And so what we try to do is really provide all the different ideas and maybe templates that a teacher can take and customize it to fit their students as well as their communities.
Wow, great. Now, Jeff, I don't think I need to sell the viewers and listeners on the importance of solving this problem, nor on the value that CTE education can have in helping bridge this gap. I think I can already hear my viewers and listeners, those education stakeholders, like their biggest fear is not that this is a problem or that there's a way to solve it, but they're probably fearful of just how to get started, right? For these schools, the school leaders, the teachers out there who are interested in bringing healthcare CTE into their schools, into their classrooms, but they don't have the first idea of how to get started in terms of implementation, what advice would you have for them?
The first piece of advice that I would say is invite the industry partners to the table. I think one of the downfalls of education is we always ask for money and we always ask for volunteer hours, but we don't ask what the community or industry needs, and are very rarely. And I think that that's one of the things that's unique about CTE is that because of Perkins and the laws around CTE is that we have to have direct impact. So in my current role, the school district where I am a teacher on special assignment supporting our CTE teachers, our airport just opened up and just added commercial airlines. And so we started a high school aviation program. We are basically our auto body and our auto dealership said, hey, we need more auto techs. And so I think that's one of the cool things about CTE is that we can actually fulfill a direct need in our community. And the purpose of healthcare, right, is how do we train and create the opportunities so we can get those medical assistants or those phlebotomists, EKG technicians. These are entry-level positions that are vastly underfilled in our community. And we basically, instead of asking what we need from them, we can ask, what can we do to better support you? And I think that's one of the things that is really cool is figuring out how do we get those partnerships. And I think when you start with that kind of mindset, it kind of all the other steps fall into place.
Oh, gosh. Music to my ears. I think that's, and it does reflect my own experience. I feel like every great education initiative that I've ever seen happen on the ground, it's when the community's been brought in. It's when the people that you're trying to serve outside of the school are brought in to provide direct input on the campus with respect to those particular programs. You're definitely speaking my language.
Yeah, and I think one thing that's interesting that research shows that for every dollar that we put into a CTE program, the value that puts back into the community is about $12. And so that's one of the things that is really great is that we can fulfill that need and we can build those connections. and they don't have to spend the money on training because these kids are already coming trained. And for medical assisting, right, a lot of times you don't have to be licensed when you get that job. You just have to be licensed within the year. And so people will not get the license, and that employer just has to retrain a new person. And we can meet that need because those kids can leave our schools with that license in place or certification in place, and be a direct hire.
Did you say $12 in impact for every dollar that's put in? That's a heck of a
Correct.
rate of return, Jeff. I feel like any for-profit business would like those numbers. This is really, really cool. Our guests have been Dusty and Jeff. We're talking about using CTE, career technical education, to bridge the gap in the healthcare professions pipeline. I think we can all get behind that. You can find out more about our guest work by visiting icevonline.org. This has been a real pleasure, gentlemen. Just super illuminating stuff. I know our viewers and listeners are loving it. Before we let you all go, I'd like to ask each of you our final question. Same question for both of you. We'll start with you, Dusty. If with the snap of your fingers, you could make any change to the education system, what change would it be?
You know, and I'm a bit biased on this, but you know, I think that you see the evidence that it works. But I would make CTE the cornerstone of the district, and you're seeing this in a lot of areas. I remember probably like 15 years ago, I went to an academy out in Phoenix, and I thought it was amazing that the students would choose their cluster. Like, I'm an automotive student, and that's the cluster that I'm really focused on. And every single class, whether it was math, science, English, didn't matter. It was focused around that automotive cluster for that student. So if they're in English class and they're reading The Great Gatsby, part of their project is learning about automobiles, you know, back in the day, and learning about the types of cars and the engines and those types of things. And so it was putting that career piece in every aspect of what a student's doing. And you're seeing this model really pop up across the country. But with the snap of the finger, I'd love to make all school districts like that, where CTE was the cornerstone and everything fed into that. Great
stuff. Jeff, same question.
Unfortunately, Dusty stole like my thunder, but it's exactly what you said. I think we need to stop putting kids in boxes. We need to stop forcing that it's a one size fits all. And we need to stop thinking that it's university versus CTE, right? Because a lot of our CTE programs could be university based. And I think that's one of the things that we see, that CTE provides basically a crucial opportunity for kids to apply their learning. And that's why kids nationally, if they're in a CTE program, they have a 98% graduation rate. And I think that's one of the things that gives them a sense of belonging. And it also gives them a context for their learning. And we see that that's crucial for kids who maybe have learning disabilities. It's a crucial way for kids to connect the learning if they're English as a second language. And so, yeah, I really wish that CTE became a priority and became the cornerstone, because a lot of times it's an us versus them, or it's a situation where we say, oh, we don't have money for that. And I think ultimately when we look at CTE, it gives kids their knowledge, it gives kids problem solving and critical thinking skills that they need. And I really wish that it would become the cornerstone of every school and education program.
Really terrific insight from both of you. I really enjoyed this conversation. You've given me a lot to think about, a lot of notes I've taken on this end, a lot of great information that I got to go take to my colleagues in education, because I think there's a lot of cool things we can do with your information. Thank you both so much for your time this week.
Thanks for having us.
And
thank you for the opportunity.
You bet. Thank you all for checking out Big Ideas in Education.
The views expressed on the preceding program have been those of the hosts and guests and do not necessarily reflect the views of Academica, its clients, staff, affiliates, or advertisers.